So let's proceed with health and nutrition. The gracious hostess here is Dr. Lalita Kaul. Dr. Kaul is a well-known teaching professor at Howard University College of Medicine. Each time Dr. Kaul appears on our show, she educates the community on health and nutrition. So let's see her education for us for this week on this screen of Women's Worldview.
Good morning. I'm Dr. Lalita Kaul, speaking from Health and Nutrition. It's a pleasure with me to present to you another segment on this health and nutrition. And today I want to talk to you diet and type 2 diabetes and also lower your weight. In one of the segments I had given some definition about what is type 2 diabetes and type 1, but I will very briefly, I don't want to take that much time. Type 2 is also called maturity onset diabetes, and it happens more than after 45, and some of the reasons are obesity and not eating right kind of food, and your doctor will decide whether he or she is going to put you on just behavior modification changes or on medications. And type 1 is obesity is not a major problem. It can set early, and most of the patients have to go on insulin. Also in type 2, sometimes the physician might feel you need to go on oral medication, insulin, or combination of factors. So I want to talk today more about diet and weight, which you can control, which are the environmental factors. As I said in my last segment, the genetics we cannot do much, but definitely you can do something about the environmental factors. The frequently asked questions are, do I need to buy special food to lose weight? We're talking in relation to diabetes. No, you don't need to buy special food. Whatever background you are, South India, North India, Bengali, or just America, living in Midwest, Southwest, you just keep your, no. In the next few slides, I'll show you how to make better choices, common inexpensive foods that you like. And it's very important to keep the diet, the foods you like and enjoy. If the diet becomes like a prescription, you have to take salad in the afternoon and only this, then compliance is very poor. Sometimes I have patients come and after taking the complete history, looking at their chart and physician's reports, the medication, then I plan and they say, oh, this is a diet? I said, no, this is part of your life. You have to make behavior modification changes. You just enjoy what you are doing. So we don't have to do drastic things. And the other is, do I need willpower to go hungry so I can lose weight? No. And some of the people will go starve all day, have a big meal, or just scringe, and that is also not good for your heart. In fact, my own research studies, which someday I hope to present, that is what my experiment showed, which I did first in the rats and then of course in human beings, what difference it makes. Answer, as I said, is no, you do not need to starve yourself. You can eat what you like, but just make little behavioral changes. A healthful weight loss plan is promote slow and gradual weight loss. If you do drastic, all those crash diets are out, what will happen is you will lose say 5-10 pounds, and then when you go back to your actual eating pattern, you will gain back 80%. Some people tell me they have one wardrobe and they gain when they lose. And an NIH study has shown that this can be more harmful. It's better do not lose weight. So the best way is lose 1 or 2 pounds a week, and it's going to stay with you. So it allows you to keep the weight off for a long time and improves your overall health. If your scale shows you lost 1, which is great. and does not leave you chronically hungry. I have seen going to the parties, some people carrying their, I don't want to mention the names of the commercial thing, carrying certain foods, they have to warm, they make a big production about it. I am on a diet, and next time I meet them or month or two, I don't see any difference, but of course, I don't say anything because I am also a guest there. You want to include if you have diabetes, overweight, or just plain overweight. Physician says if you lose weight, you won't have to take as much hypertensive medication. If you lose weight, your glucose tolerance will be better. So, plenty of raw and cooked vegetables, and mostly in our Indian American community, we like to cook, which is fine, but don't overcook them. If you cook them in lot of water, don't throw the water, because the water, you lose your water soluble vitamin. Cook them in a shorter period, and by all means cook and put all the spices you want. And high fresh fruit is very, very important, and fresh food gives you vitamin C, vitamin A, and it gives you fiber, phytochemicals, which are very important. So, fresh fruit. In the case of diabetes, the best fruit is berries, cranberry, blueberry, strawberries, all the berries. You can start the day with half a cup of berries, 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 but the other fruits are good too. Eat more nutrient rich, high carbohydrate foods. Potato is not a, people say, oh, potato, you can have baked potato, but don't deep fry it. And when you bake it, you can make it very interesting by putting different low calorie sauces. That could be your, snack. And the grains are very important. They are high in carbohydrate. They do not get broken up in one step as like sugar is only one bond. They go slowly, slowly, slowly down the gut. And not only are they good for cancer prevention, diabetes, lowering your glucose, they are for every study that has been done, documented. And you have whole grain, you can have brown rice, oatmeal, anything. The most important thing is when I plan a diet, I ask my patients, what do you like in the family? And this is how I teach my medical students too, so that they become better doctors, more have better quality of life for their patients if they, and we in the Indian community, Indian American, we like dals, they are very healthy, and but when you do tadka, just use very little oil with your onions, whatever. Rajma, kidney beans are excellent, excellent, they lower the cholesterol, studies have shown, and chickpeas or chana, these are excellent in our Indian food. So, we eat it, but do not eat that much processed food, whole grains. And here you have said bread is calorie dense. Calorie dense, we mean it gives you more calories, healthy calories. It does not give you simple like sugar and it just washes it down. We need that bulk in our intestines so that we have full movement and nothing is remained behind. That can be a precancerous stage. This is to give you an example of a dense whole grain, and you can see the difference between whole grain wheat cracker down to oatmeal, how much dense they are. They contain, the dense food contain less moisture, and how much calorie per pound they have. This is per pound, of course, we don't eat that much. So, oatmeal, if you like oatmeal, I do not push it, the oatmeal is good, you have diabetes, you have hypertension, you want to lower cholesterol, but I first ask, do you like oatmeal? No, that's not for me. All right, let's explore the foods you like, and they give the list, okay, this is the food. And then cut back on high carbohydrate, low foods. We love pastas, but now they have whole wheat pastas also. If you make pastas at home, they are healthier, Outside when we eat in restaurants, it has lot of butter, salt. Once in a while it's good to enjoy with friends. I tell them you don't have to sit home and say I'm on a diet, I can't go anywhere. No, enjoy the food you are eating. Then these foods have very little fiber. I have many vegetarians come for consultation. I don't eat meat. My cholesterol is high. I'm not losing weight. So when I take the diet history, they say I didn't eat my breakfast. I was having crackers, I was having pretzels, this benign. But they have very little fiber, very low fiber. And then the rolls and donuts, and they have very low fiber. So you have to take more high fiber diet, both for diabetes and losing weight. And these are sugar rich food, but this is not to say when you are going for a wedding, a birthday party, enjoy it. Even in diabetes diet we include it. If your sugar is, enjoy it. Don't make yourself, you know, God, I am on diabetes, that's the end, or I am overweight. You have to do your body. Now the calories, don't drink your calories. More studies are coming, more of them have fructose in it, and it slows down, it affects your diabetes, hypertension, weight reduction. You have to, water is the best, or in summer you want iced tea. And switch to non-fat dairies, non-fat dairies. And we have now low fat, fat free, but again if you take double the quantity you beat the fact. So you want to, we have everything, but you have to take that also in moderation, because calorie is a calorie. It may not have fat, but it has calories. So we have so many products, and I already talked to you about this, which is very good part of our diet. And we talked about it. Use fats and oils sparingly. Get a spray, there is olive oil spray, and most of your cooking you do, and you will see with spices it tastes. Only for frying you use that. Don't add sugar. I have had patients go from 2 teaspoons to 1/4 spoon, and so sugar you have to cut down. Success. Research has shown most people who lose 30 or more pounds can keep it slowly. That goes for diabetics. You see your glucose medications come down. I mean, I have seen these cases in my own clinic and in my private practice. Definitely there is a success. Some do very fast, some do very less. Exercise, which is a topic for another segment, how important. You don't have to be a marathon runner and go on the. So exercise, we'll talk more about in the next segment, will help cut your glucose, and which is very important. That can help you. So it also improves action of insulin. If you are on insulin, you can exercise with a friend. Important is also stay hydrated, carry water with you. And so we'll talk more about exercise, but incorporate please some exercise, whether it's just brisk walking. Some of my patients said they cannot walk that much, it's not safe outside, and so I tell them walk in your apartment, do anything. So to sum it up, it's very important to lose the weight and keep it within your range, and modify your eating habits, and you don't have to make drastic changes. You will definitely see the success. Thank you very much. If you have any questions and comments, please send them to the studio. At my next segment, I'll do my best to answer your questions. Thank you.